there are some people who may be just learning to do healing work, Reiki, et cetera, where they will find themselves feeling the symptoms, but they don't know how to release them, and then they end up having all this extra gunk in their bodies. How do you recommend that people don't hold on to?
It's a real risk. I call it being an out of control clairsentient. And most of us have been out of control clairsentients at one point in our development. I certainly was for the first like 25 years of my life, always picking up other people's symptoms, always sick, going into a hospital. I was miserable. I was just feeling all of the illnesses, not only of the sick people, but the dead people as well. And so learning to control your clairsentience is really like a prerequisite before doing medical intuition. And it's really something that every psychic should do, is learn to control their clairsentience. The most important way to do that is that you have to become really self-aware. And so you have to become self-aware physically and emotionally. That means you have to make it a practice to kind of tune into your body and ask yourself, how am I feeling? And then also to tune in and ask yourself emotionally, how am I feeling? And one thing that helps with that, of course, is therapy. So I recommend that all healers get therapy. Spend some time in therapy during your lifetime, even if you think you have no issues, because if you think you have no issues, you definitely do. Those are the ones that have the most issues, the ones who say, I'm perfectly healthy. Get therapy. Why? Because it trains you to reflect on your feelings. You can also do mindfulness training, which is another way of learning how to become more conscious of your body and your emotions. And when you get more clear about what it is you're feeling, then you're in a better position to distinguish what you're feeling from what you're picking up from somebody else. And so what I had to learn to do at a certain point when I was getting control of my clairsentience is I had to start asking myself every time I felt something, is this mine or is this someone else's? And so, and I do that to this day. If I'm walking around and all of a sudden I feel sad out of the blue, I immediately ask myself, what happened to make me sad? Did something happen? Why am I sad? What's going on? If there is nothing I can find in my life that made me sad, and of course, you're not going to find it if you're not emotionally self-aware. You have to be in the practice of recognizing your emotions and claiming them. You can't walk around saying, I'm fine, when you're not fine. You have to really know when you're not fine. And when I was younger, I didn't know when I was not fine. I was a stoic. I was raised that way, to just, soldier on, don't talk about your feelings. And I didn't even know how to say that I was sad. But I did a lot of therapy, and now I know when I'm sad. And when I catch myself feeling an emotion like sadness or anger or anything, grief, and it's not mine, what I then do is I trace it to its origin. And so I kind of imagine a string of light going from me, and then I trace it. Where does it go? And it's going to go to another person. So if you're in a crowded room and you suddenly feel sad and you have no reason to be sad, you can just kind of trace that line of light to where it's coming from energetically. And when you're aware of where it's coming from, then you can cut that cord, cut that. So cutting that cord is just about, if you just imagine that you have a pair of scissors in your hand, energetic scissors, and you just cut your connection to the person that's sad. And now if you don't have to cut the connection, if you want to help them, and that's the reason you picked up their emotion, is because you're a healer and you're meant to help them in that moment, and you've chosen to help them, that's fine. You can stay connected. But you don't want to be in a situation like you mentioned where you're just picking up stuff randomly and it's interfering with your life, or like you said, you're keeping it. So another thing that's important is if as a healer you are connecting clairsentiently with your clients, which is often inevitable, you have to, first of all, be aware you're doing that. Be aware that, like, if you're a Reiki practitioner and you're have someone on your table, you have to be aware if you're energetically connected to them during the session. If you're a nurse and every time you have a patient in your office, you're connecting to them energetically, you're going to go home at the end of the day exhausted, because all these patients will be connected to you energetically. And I know this because I used to do this with all my students. I would stay connected to all of them and I would be exhausted. And so it's a good idea, if you're in the healing field, whatever you're it doesn't matter which healthcare profession you're in or which healing profession, to get in the habit every day at the end of each interaction with each patient, do some kind of ritual to release them or to cut your connection with them. And then at the end of the day, do a bigger ritual of, okay, I'm leaving all of this at the office. I'm not bringing any of this with me.
This brings me to yet another question. If you do still have this connection, it can go both ways, right? You're not just taking in their symptoms. They can also drain you. Is that accurate?
Oh yeah, they can drain you. And this is another thing you can do. You burn sage. You can burn sage or Palo Santo, whatever, also to clear the energy. Yeah, they can drain you. You could also send them energy that's not good for them if you're not a totally clear vessel. And so this is another thing that's important, is you have to be a hollow bone. And the idea of a hollow bone, it comes from Fool's Crow, who's a Lakota medicine man I had a couple of books written about him, and he was a healer. And he talked about how the healer has to be a hollow bone. You've got to get out of the way so that the healing can work through you. We're just vessels. If you're not a hollow bone, if you're bringing your stress and anxiety and different, upset into your practice room or your session room, you might, accidentally share that with the client. And so all of that inner work is so important, and it has to be done on a continual basis every day. There has to be that check-in with yourself. You have to be aware of your emotions. And if you're upset, you might have to just cancel. You can't work with clients when you're very upset. You have to cancel. Also, if you're sick, you have to cancel, because if you're sick, it might not only impede your ability to be accurate. That's the biggest threat. Is it's going to impede your ability to be accurate. But it can, people can also kind of pick up or resonate with your low energy, because you're a healer. When you're in a position of power over somebody, which you always are as a healthcare provider or a healer, there's always a power dynamic there. Same with teachers. People can kind of match your energy unconsciously. And so if you come into a session, down and out, they might walk out of the session down and out. So, yeah, you have to really work on self-awareness to do this work.
Yeah. Now, the other question, the burning question, was you were talking a few minutes ago about the different traditions that you studied with, the different ethnic traditions. And I wonder, is there anything specific that you can come to mind that's different in these different traditions from, just sort of the mainstream American method? And what are the commonalities between the different traditions?
Okay. Well, one thing that a lot of people aren't aware of is that medical intuition is a very old tradition. And so in the book that I'm working on now, called The Medical Mystic, one of the things I'm doing is telling the history of medical intuition. And, there are traditions throughout the world in indigenous communities in Africa and North and South America and the Pacific Islands, of healers who engaged in what used to be called psychic diagnosis, and we now call it medical intuition. And so if you go to the Philippines, there's a Babylon tradition. If you go to Hawaii, there's the Kahuna, Haha, who do that type of work. If you go to South Africa, there's the Sangoma tradition. And then in a lot of Native American communities, there's medicine people who also psychically diagnose. And so what we have gotten kind of passed down to us in the mainstream is kind of a non-ethnic, acultural version that kind of presents itself as universal, which of course it's not. And it also doesn't acknowledge its heritage. So for example, Carolyn Myss and Norm Shealy coined the term medical intuition. But Norm Shealy actually learned about medical intuition from Henry Rucker and Henry Rucker's organization. And Henry Rucker was an African-American psychic in Chicago who had his own psychic research organization. And he brought 8 other African-American medical intuitives to Norm Shealy's lab to be tested. And Sheely found that their group as a whole was 98% accurate in diagnosing any patient he gave them. But, that history is kind of forgotten. And then Sheely and Miss went on to coin the term and to write all these books. And there isn't really an acknowledgement of that African-American history of the tradition. And so that's one of the things I'm hoping to rectify. But one thing I can point out that is different, besides just the absence of any discussion of culture, is also has to do with tools. So, like I was taught by different teachers, and when I had teachers from the mainstream culture, they would teach me that I should do all of my work without any tools. And so no sage, no sweetgrass, no crystals, no ritual objects, no special clothing, no altar. Behind me, what you see behind me is a giant altar. And I work with altars. Well, there was kind of this expectation that this work is supposed to proceed in kind of a clinical way, devoid of culture, devoid of tools, no art, no beauty, no music. That's the other thing, music. I use music in my work. And there's a way in which traditions which use those elements like chanting and music and smoke and dance and different things are sometimes portrayed as primitive or superstitious. And yet if you do the same exact work, right, we call it medical intuition, and we put you in an office with white walls, suddenly it's like a legitimate practice. It's the same exact thing. And so I have practiced both ways. I can practice with absolutely no cultural tools, but I prefer to practice now with my cultural tools. And so when my clients come in to see me, I have an altar, I have crystals, I burn sage, I play music, solfeggio frequencies in the background. It's very relaxing. I have art that I put up in the room. I decorate the rooms that I've rented. I will decorate them. And that's coming from the ethnic traditions that I come from.
Thanks for listening. Check out Castle Gate, a novel based on my own ancestral healing journey, at lisabonis.com. In 1921, 4 men set off from Scotland to the United States. Will Garrock, his brother Pete, his son Willie, and his nephew Thomas, all coal miners. They left behind the miners' rows and the nationwide mining strike with its soup kitchens. Their destination was Castlegate, Utah, where they had kin to welcome them before sending for their wives and children. They prospered in America, working in one of the finest mines in Utah. Until that tragic day, March 8th, 1924. Disaster struck. 3 explosions, trapping 171 men inside. Rescue crews worked tirelessly for days, but sadly, they could not save a soul. Women were widowed and children were orphaned, and some never recovered from their broken hearts. Castlegate is the true and tragic saga of a Scottish family whose dreams of finding their fortunes in the bountiful coal mines of Castlegate, Utah during the Prohibition era explode in one of the most devastating mine disasters in American history. Learn more at lisabonis.com.